It's Mental Illness Awareness Week across Canada, and this year's theme is Recovery is Possible. Every year, the Canadian Alliance on Mental Illness and Mental Health chooses 5 individuals living with mental illness to help break the stigma associated with it. One of those people is Sandra McKay, author of My Schizophrenic Life, The Road to Recovery from Mental Illness. She joins me now from Ottawa, along with the chair of this year's campaign, Dr. Karen Cohen. Ladies, good morning.
Good morning.
Good morning.
Doctor, I want to begin with you, just to highlight why this campaign is so important.
Well, the Canadian Alliance on Mental Illness and Mental Health is an organization, an alliance of organizations who work to provide services and supports to people with mental illness as well as the healthcare providers. We have 2 important campaigns during the year, and this is one of our very important ones, which gets people living with mental illness in recovery to be able to talk about what are the services and supports that they need and made it possible for them to live in Canada in recovery. And the important message for us is that we need to talk about it, we need to give people the supports and services they need, and we need to make them accessible.
Yeah, and you need to put a face on it, and that's where Sandra comes in. Sandra,
Absolutely.
Your story is amazing. You have schizoaffective disorder, but at 15 you were diagnosed with paranoid schizophrenia. I want to talk to you, though, about the role art has played in helping you to cope.
Yeah, I started painting in college, at Langara College, and I went on to get an art history degree. But I found art was really healing for me, a way to express my emotions, to get it out through paint or on paper or through clay work. It was really a good experience for me to use art as a tool to recover.
Yeah, tell me more about that, how you expressed your emotions through art. Was it almost kind of cathartic for you? And would you use different colors, for example, depending on the mood, depending on how you were feeling?
Well, my early work were psychological portraits, so a bit of the dark side, a bit of a yin-yang, where they had also positive elements as well. As my art developed over the last 30 years, it's going to be much more positive, more and more of that. And I think it reflects my whole journey as an artist and as a person with mental illness.
And the theme this year is Recovery is Possible. And I think that would speak to how lonely it must be when you first get that diagnosis and think, what do I do? Where do I go from here? Will I ever recover?
Yeah, when I was 14, I started to hear voices and things like that, had other symptoms. It was really difficult. And instead of really going for help, I knew nothing about schizophrenia. I didn't really know what symptoms to look for, so I just kind of held it inside and really didn't talk to people. So it wasn't until I actually acted out that my parents thought, Sandra needs help, and they took me to hospital, and I was diagnosed.
Doctor, can you pick it up from there? Recovery is possible, but it's then the next step, getting help. Tell us about that and where people go from that point.
That's exactly it. One of the things that we need to be able to do is get information out to the public so that we're able to recognize what might be symptoms or signs of concern, and that they know where they can go for help. And once they get the courage and they have the support to go get it, that it's in fact made it available. So that publicly funded service, whether it's your family doctor, through the school system, private practitioners such as a psychologist or psychiatrist in the community, once people get there, we want to make sure that it's available, and it's available to them in a timely way, because one of the things we know is by acting early and providing people help earlier, they're going to have a better outcome and a better recovery.
What kinds of obstacles, though, might they face?
Some of the obstacles are waiting lists and things like that. When it's a publicly funded service, we may end up having people waiting longer than they should. Some of the services are not covered by public health insurance plans, like the services of a psychologist or a social worker in communities, so that limits access as well. Certainly we know there's a great demand for mental health help. Many of the complaints and concerns brought to family doctors are related to mental health. We just need to do a better job at making sure once a need is identified, people get the right care in the right place from the right provider.
Yeah, and Sandra, you did that. You got the right care, you got the right help from the right provider. Want to know, when you look back at those dark times, as you called them, and the art you created during those times, what do you see now?
Now I'm a changed person, really. I had a major relapse in 1998. and that was when I was re-diagnosed with schizoaffective disorder, and I had to really start from square one. So changing the way I live my life, having a daily maintenance plan, finding supports in the community, finding other people with mental illness I could talk to, developing art and writing at that point, and publishing my memoir at that time, and really finding a niche in society as a public speaker and these other roles I've been playing out. So it's really been a growing experience, and with more self-esteem and more maturity and more confidence, I have a lot of hope that there's going to be more good things in the future as well.
Well, you've done the greatest thing, the most noble thing, being that you turned your experience into a tool that will help others. You're going to be meeting with the Governor General later today. You held up your memoir that you've written that you're using to help other people as well. Sandra, did you ever imagine, when you were 15 years old, that you'd be at this place today?
Never. I would never have imagined it. And really, looking back, I can see a lot of positives in my life, getting my bachelor's degree, getting married, meeting people that, I could help, that come up to me and say, Sandra, I heard your story, it's wonderful, you've really inspired me. So it's really been a blessing this year that I've really come this far. I'm really happy these days.
All right, one of the faces of the mental illness campaign, Dr. Karen Cohen, is the chair of that campaign. So good to have you both with us. Thank you so much.
Thank you.
Thank you.
Coming up on Canada AM tomorrow.